More kids in the hospital than ever with COVID-19. In Texas, there are more than 300. And in Dallas County, there are 0 pediatric ICU beds available. A judge there offering this warning today if your kid needs one.
In Dallas, we have 0 ICU beds left for children. That means if your child's in a car wreck, if your child has a congenital heart defect or something, needs an ICU bed, or more likely, if they have COVID, need an ICU bed, we don't have one. Your child will wait for another child to die.
That is so disturbing. Mark Wallace is the president and CEO of Texas Children's Hospital in Houston, the largest children's hospital in the nation. Thank you so much for joining us. When you hear that warning, what is your reaction? How worried are you about a similar scenario at your hospital?
Well, we are worried about that. We certainly see the surge occurring in this region of Texas, in Houston and in Harris County. Fortunately, at Texas Children's Hospital, we've been anticipating and planning for this surge for weeks and months, and so our team is ready from a bed capacity standpoint and also from a staffing standpoint. But the surge that the judge was talking about in Dallas, it's really occurring here in Houston and Harris County and Austin as well. And so it's very serious. There's a limited number of PDICU beds available in our state of Texas. Fortunately, we had a few discharges last night, and so we do currently have a few vacancies at Texas Children's in our PDICU. But it's very serious, and it cannot be overstated. The story that you heard from the judge is true also in Austin, in San Antonio. Fortunately, we do have some beds, PDICU beds here at Texas Children's Hospital.
Given the state, though, they'll likely fill up quickly. You are urging the FDA to authorize the vaccines for kids as young as 5. Why is this such an important step?
Well, it's really important to get everyone vaccinated ultimately in the United States, and we've been working really hard at getting 12 to 15-year-olds vaccinated and 16 to 18-year-olds vaccinated. We know that the FDA will grant emergency authority soon. It's under careful consideration by them. Texas Children's Hospital, we've been participating in those trials and in those studies and submitting the data and the information. But as 5 to 11-year-olds return to school, if they're unmasked, if they're unvaccinated, that's a formula for those children getting COVID, ending up possibly at Texas Children's Hospital, maybe even one of our ICUs. And Pam, we want to prevent that. And so the best defense that we have against COVID-19, whether it's for children or adults or adolescents, is everybody needs to get vaccinated. And then we need to be wearing masks also.
But the reality is it hasn't been approved for kids under 12. So what is your reaction to the battle in the state over kids and masking in schools?
Well, we want to do what's right and what's in the best interest of public health for children and adolescents. And we think, requiring that children as they return to school as well as adolescents wear masks, we think that makes eminent sense. And so while we still have very low vaccination rates in the 12 to 15-year population in Harris County, the vaccination rate's only about 26%. We think that it's really, really important that as children and adolescents, teenagers return to school, they need to be wearing a mask. If not, the surge that we're seeing today is going to get worse. It's going to exacerbate. We're going to see more cases, and we're going to see more adolescents and children end up in our emergency rooms and our beds and PDICUs, and we don't want that.
No, and a tool to fight that, of course, as you noted, is the vaccines. But I want to ask you, the FDA has said that they're waiting for the emergency authorization for kids under 12 because they're still doing the clinical trials and there has to be a certain amount of time. What do you say to that?
Well, we've been participating in those clinical trials, and just recently we submitted some additional data to the FDA regarding the experience of the trials that Texas Children's is participating in. They need to expedite this as much as possible, and I know that they are. But, we're heading toward a disaster in so many regions of the United States, particularly the southern region, and to some degree even here in the state of Texas. And so as quickly as possible, as kids are returning to school in that age range, 5 to 11, we need to be able to get them vaccinated through the emergency authority. It's very important.
Okay, Mark Wallace, thank you so much for your time today.
Thank you.